morning. I'm Alina Capitanu, Vice President of Macomor Cluster and Clusters4health Project Coordinator. And I would like to thank you all speakers and all guests for joining the seventh breakfast dedicated to discuss how we can support Ukraine in order to rebuild the infrastructure, logistics and resilience. At the beginning, I would like only to give you a brief overview of a project to have a short introduction in order to know us, the Clusters4health consortium partners. I would like to start with Kraków LifeScience Cluster, as this is our guest life science open space also, and to support and to thank Joanna and all her team for the support that it's provided for us, also to Gregory. And the other partners of Cluster4health Project Consortium are Oslo Cancer Cluster, Cluster Emilia Romagna from Italy, Biocat from Spain,
Ukrainian too.
and from Romania, it's Macomor Cluster, the Romanian Cluster Association, and the Ukrainian partners whom we are very appreciated and we are looking forward to further support, Rivne TACMed and ProMedMan. I would kindly ask you for your attention in order to provide a little bit of the view of what clusters are. Clusters are powerful engines for innovation and resilience in healthcare, and this is the idea of the Clusters4health project to foster collaboration across companies, university, and healthcare providers using the power of clusters. And the general specific objectives of our project are the following: to strengthen the resilience and competence of Ukrainian healthcare ecosystem, to support Ukraine's integration into the single market, to establish a strong collaborative framework between EU and Ukraine, and that is why it's very important to have this kind of events to support discussion and collaboration. And we are promoting cross-border cluster collaboration in order to adopt innovative technologies in healthcare. Between our specific objectives are a mapping of disrupting Ukrainian healthcare value chain. We are currently working on developing and updating the Ukrainian medical cluster strategies. And also a very important part of our project is to build the capacity of Ukrainian clusters through training and mentoring programs. We are connecting Ukrainian startups with the European ecosystem one, and we have developed an accelerated program in this respect. And we are very keen in developing a joint European-Ukraine roadmap for a resilient and smart health ecosystem, and your feedback in this respect is very much appreciated and needed. One of the main activities is to develop an European-Ukrainian cluster accelerator lab that is supporting the capacity building of the clusters. We are doing this facilitation of the European Union Ukrainian matchmaking, and we are quite willing to develop cooperation agreements between various stakeholders. And one of the other activities very important is to develop pilot projects. And your project, your needs can be translated to projects and to be further submitted in order to have funding for the project ideas that you do have. The main capacity building components are the following: to develop the cluster benchmarking strategy development, to have deep dive learning mission in European Union countries. We have organized already in Norway, in Spain, in Emilia Romagna, and will be organized also one in Romania and one in Poland. We are supporting best practice transfer and training in various topics like project management, regulatory frameworks, or access to finance. In long-term vision, the project is very willing to support and contribute to a resilient, competitive, integrated European health ecosystem, to support the adoption of European Union standards and policy healthcare innovation, to develop a permanent platform for collaboration between the European Union and Ukrainian clusters, and to be a model of cross-border solidarity, innovation, and capacity transfer, using these replicable in our also strategic sectors. Shortly, this is about our projects, and today's focus on the breakfast that is hosted by Kraków LifeScience Cluster with the support of Joanna and Gregory is to find out more about your needs, how we can support the infrastructure, logistic, and resilience healthcare ecosystem, and to support the Ukraine recovery and to really create opportunities for long-term collaboration. And in this respect, we'd like to give a floor to our speakers. And I give a floor also to Joanna to moderate. But I know that Mr. Oleg Vivzianik is quite in a hurry, and I hope I was brief enough in order to meet, agendas, short things. Thank you so much for the speakers that have joined today, and we are looking forward for your inputs in order to further support project ideas and including your needs in the strategies that we are developing. Thank you.
Well, greetings everyone. I am pleased to be part of this discussion today. I would like to talk to you about our experience in Rivne region currently and overall during the war. We continue to operate under these trying conditions in order to ensure high quality medical assistance, not only to those who need it in Rivne Oblast, but also to all potential beneficiaries, IDPs, injured military. So in our oblast, we have quite a powerful network, primary network and emergency medical assistance. 7 supercluster and 7 cluster healthcare institutions providing medical care to everyone who needs it. We also made sure that our system is capable to meet the challenges associated with the war, providing medical care or healthcare, and given the load and how it is distributed across the system. And we constantly work on improving the healthcare and how it is organized. So on this slide, you can see some statistics. 88 healthcare institutions servicing 200 servicing beneficiaries, and we can see the number of beds at our facilities, including for IDPs. So these are the IDPs that are hospitalized and treated at our facilities, and to make sure that it is of adequate quality, proper quality. We ensured power supply, among other things, and we work to ensure uninterrupted operation of our facilities. And of course, we can all appreciate the challenges associated with the energy independence of our facilities, and that is why, as I said, we ensure a continuity of healthcare services, and of course, this includes availability of respective drugs. And we have 4 shelters, 67 radiation shelters, and 17 most simple shelters. And we are transforming the healthcare system. We can see state-of-the-art facility that was commissioned, and also rehabilitation is one of our priorities. It is one of the challenges that we are facing, so that we could provide not only healthcare, but also rehabilitation services to our patients. Our approach is comprehensive. We also cover mental health centers, the primary healthcare system, mobile support teams, and support to veterans and their families. As regards to development of our healthcare sector, as I explained, there's a facility to help rehabilitate our veterans thanks to the support of our president and the government of Ukraine. It is a facility that provides healthcare to our veterans and IDPs and everyone who needs it. Basically, it is a state-of-the-art rehabilitation facility for patients with central nervous system injuries, and we have a medical academy, and also Luhansk State Medical University, and another academy with 4 basic pillars. And all of these decisions are being continuously implemented with the help of our Ministry of Health, military administration, and of course with the help of our international partners. And jointly, we are building a new state-of-the-art healthcare system adapted and adjusted to meet the challenges of the current times, including those associated with the war, to manage our patients and external drivers, such as the lack of power supply or heat supply. So all of those are our joint challenges, and we work to meet them for the benefit of our patients, to ensure that they have access to quality care.
Доброго дня.
Greetings,
Я
everyone. I'm
Світлана
Svetlana
Моравська,
Moravska.
директор пологового
I'm
будинку
director of the
міста
maternity
Рівне, який
hospital
представити
of
вашій увазі
Rivne. And
нашу
present you
презентацію на
with,
тему
let me present you our
«Фундамент
slides.
медичної
It is called The Foundation of Life, Transforming the
заради
Maternity
відновлення
Hospital's
нації».
Medical Infrastructure for the Recovery of the Nation. That is the title of my presentation. We are in the rear, but we're not on the sidelines. And even though Rivne Oblast is relatively safe, the war still has direct impact on us. We work under constant stress, uncertainty, and increased workload. We are in the rear, but we still feel the impact of the war every day. So our main challenges are as follows. There's different conditions related to anxiety, emotional exhaustion, especially in our patients. And so we need to be able to adjust, to quickly adjust and respond to these new changing conditions for the ongoing care, even despite and during the emergencies. Besides, we need to continue on with our prevention activities, because due to continuous constant displacements, many of our patients tend to put off preventive examinations and early diagnostics. Another priority of ours is to implement new approach, clinical protocols, recommendations. That is why we value the opportunity to exchange experience and expertise with our colleagues, including from abroad, for improved quality of healthcare. To address the challenges, we take the following steps. As a healthcare facility, we are implementing a comprehensive approach, individualized approach, patient-centered, including psycho-emotional support of our women. Our goal is to create a safe and comfortable space, and also to facilitate and foster resilience in our staff. Given the martial law that is in effect, we adjust to the new reality. And one of our priorities is to strengthen our prevention efforts and screenings for women. We raise awareness about the importance of regular checkups, and our facility works to ensure the implementation of the state-of-the-art methods. We attend conferences and other events, and international cooperation and exchange of experience is an important element of our work. So, rehabilitation and psychological support. We opened the Department of Physical and Rehabilitation Medicine or Healthcare to help pregnant women and new mothers. And psychological support is also available. We have a perinatal psychologist at our facility, because every patient that we care after today requires this kind of assistance. Now, why does it matter? Because the war has increased the anxiety levels among women. It caused greater emotional exhaustion and stress that has an impact on pregnancy and on the overall health of our patients. And unless we have physical stability, it is nearly impossible to have full recovery. In terms of reproductive health, of course, the stress negatively affects the reproductive health of our women, and we have more and more couples with increasing difficulties with conception. And at our facility, we have an assisted reproductive technology center to meet the challenges of these times, and it is also an important step towards overcoming the demographic crisis and help recover our nation. So our goal is to help every family conceive a child, and that would be also our contribution into our recovery. On this slide, you can see the statistics, the number of births in 2013, over 500,000 of them. In 2021, it was around 270,000, and in 2025, 100,000. But despite of all of the challenges, we continue to function with stability, and 33% of regional births take place in our facility. So the overall tendency is negative, but we remain stable. This is another visual representation of birth dynamics at our facility. And in terms of neonatal intensive care, we have a designated unit, which is basically a unit where we fight for life of the newborn babies. And 1,010 newborns have been successfully treated from the beginning of the full-scale war. And this is the weight. As you can see, under 1,000 grams, 11 infants, and then under infants. And every saved life is a separate victory to us. In terms of resilience and development, we keep developing, we keep introducing new priorities. We are not stopping, but instead we keep moving forward. In terms of our current needs to ensure further development and improvement of patient care, we need to develop additional parking spaces. We need to set up recreational spaces or areas for psychological support of our patients. And also, we would appreciate the opportunity to expand our international collaboration for our OBGYNs, for our neonatologists, for professional growth and exchange of experience. So we work every day to ensure quality care for our patients during these challenging times and to contribute to the overall recovery of Ukraine.
Thank you very much for a great presentation, for a comprehensive overview of the challenges and needs. Indeed, quite worrying decline of a birth rate. It's a huge decline, I could say. And thank you for mentioning so clearly the needs, and we need to cooperate on European level internationally. Hope that we can support this need and further develop European projects in your area, because maternity health is quite important across Europe, so it's very much need to be tackled. Thank you so much again, and I would like to give a floor to Mariana Markova and to further present on mental health under pressure in Ukraine. Thank you.
Occupational health. Today, we are developing clinical innovations in mental health in the context of war, translating research into practical recovery solutions. Another slide, please. Today, Ukraine is living under prolonged psychotraumatic exposure. And we are dealing not only with the consequences of isolated traumatic events, but with the continuous accumulation of chronic stress. The main groups we work with are military personnel, veterans, civilians, and healthcare professionals. The most common conditions we see include PTSD, complex PTSD, anxiety and depressive disorders, moral injury, psychosomatic disorders, and addictions. But issue is functional impairment. People lose their ability to work effectively, adapt to everyday life, and maintain stable social and family relationships. The third slide, please. Despite of extremely high level of pressure, we have already developed an integrated model of work that combines research, clinical practice, and innovation. Our research focuses on mental health in wartime, occupational adaptation and reintegration, as well as veterans' mental health during their return to professional function. In clinical practice, we provide diagnosis of stress-related disorders, psychotherapeutic support, psychiatric care, and psychosocial rehabilitation. An important direction of our work is the implementation of VR-oriented solutions. For us, VR is not a separate technology. It is the part of clinical rehabilitation pathway. We use it as a tool for early stabilization, reduction of psychological tension, emotional regulation, and restoration of psychological resources, particularly or as a preparatory stage before psychotherapeutic interventions. This is how we transform clinical experience into scalable innovational solutions. Next slide, please. The main challenge today is not a lack of experience and expertise. Ukraine has expertise, but we face several critical systemic limitations. The first is the infrastructure capacity. The second is limited access to modern technologies and scalable digital solutions. The third is workforce capacity, a shortage of trained specialists and growing needs for training and supervisions. The fourth is insufficient integration into large international research and innovational consortia. And this is exactly where international partnership becomes critically important. Next slide, please. We are looking for partners for their co-development and scaling of solutions. For us, international research consortia, joint grant applications, and technological partnership in VR and digital mental health are particularly important. We are especially interested in pilot programs in mental health rehabilitation and return to work models for veterans. We are also open to education programs in mental health, training programs, and supervision initiatives. Ukraine today is not only a place of need, it is the place of unique clinical experience, real-world data, and opportunities to create new effective solutions together. Thank you for your attention.
My name is Konstantin Kolobyatnikov. I'm co-owner and chairman of the board charity fund of Bahamae. We focus to help children and for better childhood and equal rights for children and other people. And we have different programs, but one of these programs is medical programs, and what we help and what I want to say today, it's about our rehabilitation concept, what we do. It's called Brave in Spirit, construction and recovery of social infrastructure and creation of new rehabilitation capacities. If you can turn next slide, please. Our charity fund work from 2012, and we help now more 1.7 million people in Ukraine, and help more 400 million hryvnias. How I say, we have different programs. It's medicine, it's education, reconstruction, humanitarian aid, and cultural code of Ukraine. Please, next slide. Brave in Spirit, it's our project, what we do, what we did in 3 regions of Ukraine: it's Kiev region, Sumy region, Dnipro region. Results of this project, it's we was help 180,000 beneficiaries, and we open new 10 hospitals, new rehabilitation centers, and give 145 units of equipment. Problem statement: medical rehabilitation in Ukraine is operating under rapidly increasing demand due to the war. It's of course lack of modern equipment. It's shortage and overload of specialists, long and resource-intensive recovery process, funding hours only basic level of care. Patients often do not receive continuous and comprehensive rehabilitation. Charitable initiatives will fill these critical gaps. Please, next slide. Support the development and rehabilitation in Ukraine and help thousands of people return to full life. Ways to get involved: it's partnership, financial support, and joint project. With this slide, you can take a video and show if you have time.
Due to the war and Russian aggression, the need for physical rehabilitation in Ukraine has sharply increased, straining the healthcare system. In 2024, charity fund Blagome and Mondelez united to improve access to rehabilitation services. A donation from Mondelez International Foundation provided 150 pieces of medical equipment to 10 hospitals in Kiev, Sumy, and Dnipro regions, helping establish or expand rehabilitation departments. This ensures more patients can begin recovery sooner. We are proud to be enhancing rehabilitation services for both children and adults in the Kiev and Sumy regions. Through the Brave Spirit project, we partnered with Mondelez Ukraine to open a new rehabilitation unit. This initiative not only expands rehabilitation capacity, but also creates invaluable opportunities for training the future rehabilitation specialists. Thanks to this equipment, I was able to stand up and feel the floor beneath my feet. The specialists here are so highly qualified, I'm about to cry the tears of joy. Thank you for everything. Access to quality rehabilitation services is a cornerstone of recovery and treatment. That's why Mondelez Ukraine is committed to supporting hospitals and rehabilitation centers across Ukraine as part of our ongoing charitable initiatives. We extend our heartfelt gratitude to the charitable fund Blagome and Mondelez Ukraine. This appreciation, I can say without exaggeration, comes not only from the doctors of our institution, but from all the medical workers here. Thanks to the rehabilitation equipment provided by the charitable fund Blagome and Mondelez Ukraine, we are now able to expand the scope of our rehabilitation services and enhance their comprehensiveness. I wish to express my deepest gratitude to our benefactors, Mondelez Ukraine and the charitable fund Blagome, for the essential equipment they have provided. It enables us to perform our duties in safe and reliable conditions. We are deeply thankful to Mondelez Ukraine and the charitable fund Blagome for their generous assistance. Their support has significantly enhanced the quality of rehabilitation services we provide to our patients, making a tangible impact on their recovery journeys.
Thank you.
Thank you very much. I'm really happy that we have succeeded to listen to your excellent presentation. Thank you so much. And thank you to all Ukrainian speakers for providing an excellent overview of activity and important work realized in various fields. And next, I would like to give a floor to my colleague, to Carmen Mihai, manager of Magomor Cluster, to present our experience in developing European projects in various fields and to further explore possibilities of European collaboration with you. Thank you, Carmen. Floor is yours.
I don't know. Hello, everybody. My name is Carmen Mihai, and I'm. Thank you for the invitation, and I'm happy to be here. I hope I can change the slides. Thank you once again, and my presentation for today covers the topic of how Europe and European Union, and especially the clusters, are supporting the reconstruction of Ukraine, and also to give you some information on the potential collaboration for future projects. As far as I could see, there's a great need for international cooperation, especially under grants for the organizations in Ukraine. So just to give you a little bit of information on the context, of course, the war disrupted the entire industrial value chains, and that's why European Union has used the cluster organizations to act as an instrument to rebuild these chains and to integrate Ukrainian companies in the single market and the acceleration accession. That's why 6 EU-Ukraine cluster partnerships have been funded, and there are also some other projects, the Eurocluster projects, having some Ukrainian partners in the consortia. And we have also the Ukrainian Cluster Alliance Network, and all these programs concluded in more than 45 million budgets for these programs. Having a more comprehensive look on the EU-Ukraine Cluster Partnership Program, this program has its objectives as to integrate Ukrainian business into EU value chains, to foster cluster capacity building and SME support, and to accelerate green, digital, and resilient transitions. That's why 6 partnerships, as I mentioned, are funded, and they are including entities from Ukraine. The partnerships are covering different ecosystems. One is, of course, health, and Clusters4health is one of the partnerships. Of course, I'm not going to present it. The other partnerships are for example, in the field of construction and furniture, in the digital, and other topics such as electronic, aerospace, mobility. The Rebuild project is a project coordinated by our fellow cluster from Romania, Transylvanian Furniture Cluster, and it tends to transform how EU and Ukrainian clusters manage support constructions and furniture SMEs with the help of a joint reskilling and internationalization program. Next, another project focusing on a digital ecosystem is the Ukrainian EU Cluster of 5.0. This is meant to boost the and to build the strategic partnerships among digital clusters in Ukraine, Italy, and Portugal in order to strengthen SMEs' technological and digital capabilities, and of course supporting them to foster integration in the EU market under this concept of 5.0. As I mentioned before, there are also some Euroclusters projects with Ukrainian partners. 16 Euroclusters have been selected, and three featured initiatives engaging Ukrainian clusters are mentioned here. One is ECDI, the second one is Resist2, and the third one is Future-Proof Textiles. The one on ECDI is focusing on drone innovation. The project aims to strengthen European leaderships in drone technology for civil and dual-use application, integrating an Ukrainian space tech network battle-tested under wartime conditions. The consortium is led by Aerospace Daily from France. I won't go into details for each of the project, but just to give you a glimpse of what are these projects aiming to. The second project is Resist2, driving sustainability and resilience. So this is towards the automotive and the mobility sector decarbonize topics meant to rebuild supply chain resilience. The consortium is led by an organization from Spain. And the third project is Future-Proof Textiles. This is a project destined to support the digital transformation and green innovation among textiles SMEs. So these are the current running project, and I also wanted to showcase the supporting infrastructure, so the that have been built. The first one is EU Cluster Support Ukraine Forum. The second one is Supply Chain Resilience Platform. Also, there's an EU Ukrainian B2B matchmaking. And here you can find an overview, and you can search for under European Cluster Collaboration Platform. What are all these platforms doing in order to support the disrupted value chains? As I mentioned before, these are the projects and the platforms that are supporting at the European level the reconstruction of Ukraine. And further, I want to highlight some potential opportunities for building consortia and of course applying for grants. And I have searched for the funding in the funding and tenders portal, and I could find some interesting calls. As you know, Ukraine is an associated country to Horizon program, and under Horizon Mission Cancer, there are some calls that have been already opened and have the deadline in September. So here are displayed, and hopefully this presentation will reach out to you, and you can also go on and click on each of these calls and see if there is something for you there. One call is especially dedicated to support Ukraine. This is the call entitled "Development of a Research Capacity Building Program on Cancer with and for Ukraine." And this call is will fund a 5 million euros project, only one project. It has its deadline on September 15. And as I mentioned, the call is destined to set up on capacity building program between EU member states and associated countries and Ukraine in order to support Ukraine to develop or to further improve research and the capacity innovation related capacity of future or existing cancer infrastructures. And the call will fund development of a joint research training program, including distance learning modules, and will support twinning research activities, including staff exchange for the implementation of targeted research progress and projects and access to cutting-edge services. Other interesting calls are under Digital Europe program, and under this program, Ukraine as an associated country could be also eligible. These are some interesting calls, and maybe because I have, of course, listened to all the previous presentation, and maybe for the one with the mental health support can be suitable under one of these calls. These calls are destined to support advanced digital schools for AI uptake in health. Another call is dedicated to an EdTech accelerator. This is an interesting call because we'll support also it contains the possibility to offer a lump sum to startups developing programs in EdTech. And also another interesting call is the Digital Skills and Jobs platform in order to develop national coalitions for digital skills and jobs. The deadlines for these calls are in October 2026. So this can be potential opportunities to develop projects under consortia. Of course, under other interesting calls will be available next year. And maybe under those horizon calls, other opportunities may arise for the, I don't know, for the neonatal health, for the otorhinolaryngology field. So this is my presentation. Thank you very much for attention, and of course, back to you.
Thank you, Carmen, for the excellent overview of European possibilities for cooperation. So we do have now key elements of plenty of calls that have deadline indeed in September, October, and maybe there are speakers or participants in the room that are interested in these topics, in these calls, and we could further explore. If you want to comment or to mention your interest for calls presented by Carmen, the floor is yours. The idea of a breakfast was also to have an open discussion area. Now we have somehow finished our hour, but we can extend with, I don't know, 10 minutes of your time if you want to further discuss, if you are willing to further discuss the cooperation opportunities presented. One question for discussion are which are the most urgent needs. Some of them are already presented indeed, and the key challenges and needs presented by the speakers will be further integrated in our joint EU-Ukraine strategy. So we'll take note of them and translate it in our common work. So a key question could be how could partners from Clusters4health really contribute? Which are your expectations from Clusters4health Consortium? Probably to be a partner, for instance, in one of your project ideas. And in this respect, we need your feedback. Natalia, please.
Я хочу сказати дуже дякую за виступи, і хотіла ще, у нас тут є, я бачу, пані Любов Слєпова, це керівник єдиного в Україні інституту. Я думаю, пані Любов Федоровна самостійно себе представить і скаже, чим вони займаються. Це акушерство і гінекологія. І у нас сьогодні тут аж 3 інститути дослідницьких, і хотілося б їм дати слово, тому що вони дійсно готові зі своїми вже розробками долучатися до спільних проєктів. У них вже є наробки дослідницькі. Пані Любов, вам слово. Представтесь, будь ласка.
Доброго дня всім. Я можу українською чи потрібно англійською?
Так, є перекладач.
Добре, дякую. Я Любов Слєпова, медичний директор Всеукраїнського центру материнства та дитинства, що належить Академії медичних наук України. Наш центр через 2 роки йому буде 100 років. Він дуже давній центр. Ми дуже давно працюємо і є єдиною в Україні школою для всіх перинатальних центрів України. Ми дуже тісно з ними співпрацюємо. І працюємо ми за 3 основними напрямками. Це лікування пацієнтів. Нашими пацієнтами є вагітні жінки, жінки з гінекологічною патологією та діти, включаючи новонароджених. І пацієнти у нас найважчий, вибачте, прошу, пацієнти наші найважчий контингент – це пацієнти, які поступають зі всіх областей України, в тому випадку, коли за місцем проживання їм не можуть надати повний об'єм допомоги. Лікування пацієнтів 400 ліжок, клініка центру налічує 400 ліжок стаціонару. Крім того, у нас інший напрямок, другий напрямок – це освітні програми. Ми навчаємо студентів, аспірантів і інтернів. І третій напрямок – це напрямок дослідницький. Ми проводимо наукові дослідження в області педіатрії, акушерства та гінекології. Звичайно, центр наш дуже потужний, але, на превеликий жаль, у нас є теж проблеми. Я тут прослухала деякі доповіді, бачила різні проблеми. Проблеми в усіх в Україні схожі. Це в першу чергу проблеми інфраструктури. Наш центр теж потребує реновації інфраструктури. Основне – це забезпечення енергоефективності, забезпечення таких реновацій деяких відділень. На сьогоднішній день центр співпрацює з фондами міжнародними, співпрацює з українськими благодійними фондами та Банком розвитку Ради Європи, які допомагають нам у відновленні інфраструктурних об'єктів і елементів нашого центру. Будемо дуже раді долучитися до вашого кластеру. Будемо активно з вами співпрацювати не тільки в плані відновлення інфраструктури, але і в плані трансферу технологій, в плані наукового співробітництва, в плані освітніх програм. Нам це дуже цікаво. І якщо можна, то я на наступну зустріч, на наступний сніданок можу приготувати презентацію про наш центр, а також запросити всіх бажаючих до нас, щоб на власні очі побачити, чим ми займаємося і які наші потреби. Дякую дуже.
Thank you. Indeed, we really appreciate your future presentation. You are welcome to our next breakfast. And also, Joanna can present the fact that we are also organizing brokerage events, and the brokerage events are a different concept from the breakfast. It's also about pitching ideas, but also one-to-one matchmaking sessions, so you can further explore opportunities to collaborate with European partners into one-to-one sessions. Joanna has put in the chat the link for this next brokerage event to be in June 2nd. And we are inviting all speakers and all the participants from today's meeting to join our brokerage events, because we really want to support this cooperation and to develop cooperation agreements and also European projects together. So thank you so much. This is perfect. Thank you. The visual of our brokerage event, there is a link for registration. It's promoted We started a promotion quite recently, and you can find all the information on social media channels of our Ukrainian partners, and soon also all the clusters from Clusters4health consortium will promote them. And we will be in charge of finding European partners in order to develop European projects together with you. Of course, as Karen mentioned, her presentation will be available, Joanna and our Ukrainian partners will take care of providing a presentation in order to further explore the information about the calls that are available. See everything. Maybe you can indeed take advantage of these calls in your area of interest. Is there anyone, another speaker, another intervention? Tatiana?
Thank you, Alina. Thank you for all speakers and for all attending our meeting. Really, you see the difference between the territories that are very close to the battlefield and more more closely to European Union, and the needs of this territory is different. When we tell about the territory near the battlefield, we need more underground hospital, more humanitarian help, more mobile clinics, because there are many destroyed hospitals in that period. And in another territory, more closely to Europe, we want to be in the same level with Europe and to bring these innovation methods and some researchers to our hospitals, our institutions, universities. And we are very proud to be the part as a Interregional Medical Cluster, be the part of Clusters4health, and to develop the cooperation and to develop our ecosystem of region or different other regions. As you know, we develop the clusters in ecosystem of Ukraine Cluster Alliance, and new clusters built that help our stakeholders in all parts of Ukraine. Thank you for this support of Ukraine, and we are continue to work together more closely. Thank you.
For sure, indeed. And one of the need that it was very clearly stated in our presentations for prevention need. Also, this one I will notice because it's a prevention. It's a need that it's quite worldwide. Let's say it's a common need. And it was mentioned in one of the speakers' presentation, and also the reach for a timely diagnostic, for instance, that can be disrupted by the war crisis. Natalia?
Yes, I would like to thank all of the speakers. And since today we were mostly focused on healthcare, on the part of the producer, I would just like to add that, or manufacturer, I would just like to add that it is small businesses and micro businesses, especially in terms of prosthetics, endo and exo. It is growing rapidly. So it's not so much large research facilities, but rather micro and small businesses that are in need of attention, that are looking for the value chains and for the elements that are still lacking in terms of the VR rooms, infrastructure, and rehabilitation. We have some profound and in-depth materials. I mean, that's just the prosthetics alone. And so small manufacturers is a group, or our group, that requires support and assistance with integration into the European market. Thank you.
Thank you, Natalia. Well noted. Thank you for your intervention. for expressing his need. And also, I'd like to thank you all speakers and to you, to Tatiana and Natalia, for inviting them and for organizing a successful breakfast. And to Joanna and Gregory for all the support, for the ongoing support in developing this very important aspect of Clusters4health Health project. And as Gregory put it in the chat, all meetings can be reviewed by you, watched by you in at home, let's say, by using the YouTube channel, but it is put under the chat link. So thank you so much, everyone, for having such an interesting discussion and presentation this morning. And we are looking forward to invite you to the next event, or brokerage event, like it was presented by Joanna on 2nd of June, and to the next breakfast. And we are looking forward to hearing your inputs and to further develop projects and cooperation agreements together. Thank you, and I wish you all the best. And hope you will be able to stay safe.
Thank you.
Thank you. Thank you very much.
Thank you very much.